Erectile dysfunction is the topic, also abbreviated ED. And what's important to remember is erectile dysfunction is referring to impotence. And impotence is different from infertility. Remember, impotence is basically a problem referring to inability to achieve a proper erection, whereas infertility is different. Infertility is basically has to do with the problem with the sperm. Either the sperm count is low or the sperm morphology is abnormal. So, a very important distinction. So, erectile dysfunction, or ED, is a very common problem, and there's 5 reasons why it can happen in a man. The first one is psychological, usually due to some sort of depression or anxiety or stress. Number 2 and 3 are what we call organic causes, and organic causes are by far the most common. 90% of all ED cases are because of reasons 2 and 3. 2 is a vascular problem, and 3 is a neurologic problem. And vascular is the most common of the 5. Most common reason a man can have ED is some vascular problem. Number 4 is some hormonal problem. And number 5 is medication side effects. There's a long list of meds that, if a person's taking, the side effect can be ED. Now, I wanted to talk a little bit about number 2. Number 2, vascular problems. What do we mean by that? Basically, a man can have other disorders such as diabetes or high cholesterol, and this can eventually cause atherosclerosis of the arteries that provide blood to the penis. So that is essentially just like how you would get atherosclerosis of your coronary arteries that would cause a heart attack or angina. You can get atherosclerosis of the arteries of the penis, and that is a vascular cause of erectile dysfunction. Very quickly, I wanted to also touch on the psychological cause of ED. Psychological essentially can be thought of as any problems that the man is experiencing, either anxiety or stress or depression, and this is known to be a reason for a man developing erectile dysfunction. And it sometimes can also be partner specific, meaning the person is able to get an erection but just can't get an erection with his partner. So that's also a very important aspect. We'll talk a little bit more about that later. So then how do you diagnose this? Diagnosis of ED usually doesn't involve any tests, usually just clinical. But you can order some tests such as a testosterone level. I mean, technically you can order a whole bunch of tests. You can order every hormone level and do all kinds of testing, but usually it's not done. Usually it's just a clinical diagnosis. But one key thing I wanted to touch on is when we're talking about psychological reasons, what you need to have is some sort of a dialogue with the patient and ask them, for example, do you get erections? Do you ever get an erection? For example, do you get an erection in the morning or at night? Are you able to get it in a situation that does not involve your partner? Not involving partner. And the reason you ask that is because you want to rule out an organic cause, because if the patient has an organic cause, then the patient will have a difficulty getting an erection in all settings. Treatment. Well, these medications that are used have become extremely popular, and not only have they become extremely popular, but they've become extremely expensive as well. And they are these drugs that are called phosphodiesterase inhibitors. And everybody's heard of them. Everybody's heard of the brand names: Viagra, Cialis, Levitra, and their chemical names are as follows. sildenafil, tadalafil, and then the other ones as well. Now, how these medications work, essentially, is that they help vasodilation. They help bring more blood to the penis by promoting the smooth muscle relaxation that essentially leads to the vasodilation of the arteries of the penis, and that allows more blood to reach the penis and helps maintain and achieve an erection. Now, there's one very important thing I wanted to mention, is that these drugs, ED medications, they cause vasodilation, right? Now, they also cause vasodilation of the coronary arteries, in addition to the arteries of the penis. Now, there's another class of medications that's commonly used by elderly men, and that's called nitrates. And nitrates also cause vasodilation. Now, vasodilation can lead to decreased blood pressure. So if a person's taking a nitrate and then you give them an ED med such as sildenafil, what you're going to do is you're going to cause a tremendous drop in blood pressure, and that can be life-threatening. So generally speaking, if a man is on a nitrate medication, it's contraindicated, these drugs, these ED drugs, so can't give it. So you have to make sure that you look carefully at the list of medications the patient is on before you prescribe one of these erectile dysfunction meds. So let's take a look at some clinical vignettes. 34-year-old man comes to the office because of erectile problems. He says that he and his wife have not had sexual intercourse in months because he has not been able to have an erection. He says that it's so upsetting that they basically have stopped trying because it just makes them both depressed. He has seen so many television commercials lately that he expects a cure in the form of a little blue pill. He's married, has 3 kids, takes no meds, rarely drinks alcohol, and has no serious medical problems. Physical exam is normal. Most appropriate next step is... Okay, well, he's fairly young. 34 is pretty young. So what... And he does mention the word depressed, so that you kind of start thinking about some sort of psychological problem. So the very first thing is you want to rule out an organic etiology. And what you do is simply, before you jump into any test, just ask him a few questions. And the first question you would want to ask is there any situation in which you do get an erection that is independent of your wife? So the perfect question would be C. Do you ever have nocturnal or morning erections? And if the answer is yes, then that kind of shows that he is able to get an erection. He just can't seem to get one with his wife. And that, of course, will need to be explored further. Second question. 66-year-old man with diabetes and generalized arteriosclerotic occlusive disease notices a gradual loss of erectile function over the several years. Initially, he can get erections, but they do not last long enough. Later, he notices a decrease in the quality of the erections, and more recently, he becomes, by his own criteria, completely impotent. He has occasional brief nocturnal erections, but he can never get an erection when he needs one. Which of the following is the most appropriate initial step? Well, he's 66, he's got diabetes, he's got arteriosclerotic disease, so I'm going to put my money on an organic cause. My guess, and I'm probably correct, is that he's got atherosclerosis of those arteries that supply blood to the penis. Atherosclerosis of penile arteries. And that's essentially causing this gradual, and he even mentions that gradual loss of erectile dysfunction. Now, this is treated with pharmacotherapy. So it's not a psychological problem, so A is out. Pharmacotherapy, first-line drugs are the ones that we mentioned, sildenafil, those phosphodiesterase inhibitors. Choice D is actually a last option. It's certainly not the initial step. And there's nothing to indicate in the question that he needs any kind of surgery. There's no trauma or any kind of accident or anything like that. Next question. 58-year-old man comes to the office because of difficulty with erections over the past few years. He says that he's in a great relationship with his wife and is still very sexually aroused by her. He occasionally able to initiate an erection but is unable to sustain it. He takes isosorbide mononitrate for chest pain. His blood pressure is 130. He asks for the little blue pill that is so often advertised on television commercials. At this time, you should. Okay, it was a very good question. You might have even missed it. The most important part of this question is right here. He's taking a nitrate. And nitrates can cause coronary vasodilation, as can the little blue pill, which is most likely Viagra they're talking about, which is a phosphodiesterase inhibitor. Both medications can cause vasodilation, and if you take both of them, you can get a tremendous drop in your blood pressure, which is essentially what vasodilation does, and that can be life-threatening. So unfortunately for this patient, he is contraindicated to take the phosphodiesterase inhibitors that are advertised on TV. So you have to tell him that. Explain that he cannot take sildenafil, which is what this little blue pill is, because of his current medication, which is a nitrate. And then finally, last one. A 64-year-old man with hypertension, diabetes, and hyperlipidemia comes to your office complaining of difficulty achieving erection. His medications include nifedipine, simvastatin, losartan, metformin, glyburide. He has been married for 30 years. He tells you that his wife is becoming frustrated with his lack of interest in her. He denies ability to achieve erection with self-stimulation and no longer wakes up in the morning with an erection as he did when he was younger. He tells you that a friend informed him that there's a medication that can help with men who have this problem. Physical exam shows moderately obese man with normal sized testes. Digital rectal exam reveals a slightly enlarged non-tender prostate without palpable nodules. The most likely underlying cause of his impotence is... Well, a very important part of this question is that he says he denies ability to achieve erection with self-stimulation and no longer wakes up in the morning with an erection, as he did when he was younger. So he essentially, it's not psychological, because he's not able to achieve an erection even independent of his wife. So choice D is out. The thing that really strikes me is that he's got hypertension, he's got diabetes, he's got hyperlipidemia. You've got all the factors leading to atherosclerosis, and in particular atherosclerosis of the penile arteries. So without a doubt, in this man and in general, the most common cause of erectile dysfunction is vascular problems. And that would be choice E.